Placement of 12-lead ECG leads. For this skill, you will need 10 ECG electrodes and a 12-lead ECG machine with 12-lead cable. If there is excessive hair on the patient's chest, a razor or scissors may also be needed. To begin the procedure, explain the procedure to the patient. Attach the electrodes to the cables and secure the cables into the machine. The ideal position for 12-lead ECG acquisition is supine. However, most patients with acute chest pain can't tolerate this without having some difficulty breathing. Usually, the patient is placed in the semi-Fowler's position for comfort. Prepare the skin by ensuring it is clean, dry, and free of debris. Clip or shave any excessive chest hair that could prevent the electrodes from sticking. Try to avoid nicking the skin. Place the limb leads on the extremities, not on the chest. Avoid placing them over joints or bony prominences. To apply the precordial leads, begin by locating the jugular notch. Slide your finger down the sternum until you feel a slight bump. This is the sternal angle, the point at which the second rib attaches to the sternum. Slide your finger to the right of the sternum, over the second rib, and below it into the second intercostal space. Move down to the third and fourth intercostal space, then secure the V1 ECG electrode. Slide your finger across the sternum to the fourth ICS on the left side and apply the V2 electrode. Move your finger below the next rib to the fifth ICS and slide it to the side until it is positioned under an imaginary line in the middle of the clavicle and place the V4 electrode. If the patient is female, place this electrode in the inframammary line. Maintain the patient's modesty by using a sheet to cover her chest. Then locate a spot halfway between V2 and V4 and place the V3 electrode there. Move in a straight line from V4 in the fifth intercostal space until you come to the anterior axillary line. This is located where the front of the arm meets the chest wall. Place the V5 electrode here. Finally, identify the mid-axillary line at the fifth ICS and secure the last electrode, V6. Press the 12-lead button on your monitor. Enter the appropriate patient information. Ask the patient to remain still.
Hold real still for about 15 seconds.
And for your partner to stop invasive skills for a moment to minimize movement while the machine is acquiring the 12-lead. Then, evaluate the 12-lead tracing and determine how your interpretation will affect the patient's care.
What's your name, sir?
Ed Kyle.
And my name's Mark. What I'm going to do is I'm going to put an EKG or electrocardiogram on your chest. We're taking a little look at your heart on the monitor, okay?
Okay.
We're going to start off by putting some leads on your extremities. So we're going to put a couple on your legs, a couple on your arms.
Okay.
This might be a little wet and cold. And we're going to place a few more electrodes on your chest.
Okay.
Once again, these are going to be wet and cold like the ones on your arms and legs. You'll be feeling for some landmarks on your chest. It's going to help me tell where I need to put the electrodes, okay?
Okay.
And are you having any pain or discomfort right now?
Not right now.
And how old are you?
73.
And I need you to hold it real still for about 15 seconds while the monitor takes the tracing it needs.